My topic that I will be speaking about today is on drug addiction. I will be talking about how drugs work in the brain, state some facts, and also discuss who's likely more to take them and why. I'll also be talking about the treatments and drug prevention. So according to the National Institute Drug Abuse website, an addiction is a defined chronic relapsing brain disease that is characterized by compulsive drug seeking and use. It is considered to be a brain disease because drugs change the brain of how they work and the structure of how your brain works. The brain changes can be long-lasting and can lead into harmful behaviors. How does drugs work in the brain? Well, drugs are chemicals, so they work in the brain by tapping into the communications system and interfering with the nerve cells normally that send, receive, and process the information. Although it is true that people that do decide to use drugs, they are voluntarily doing on their own. And because of this, all the changes in the brain, it is so challenging for a person that is addicted to drugs to stop abusing drugs. Fortunately, there are treatments to help people to get that under control and to help them live a productive life. Combining addiction treatment medications, if available, with behavioral therapy is tailored to each patient's drug abuse patterns and any co-occurring medical, psychiatric, and social problems that could lead into sustained recovery. Some of the facts that I found were interesting. Drug abuse and drug addiction, according to the National Institute of Health, impacts all Americans because we pay the cost for it. Statistics show that the abuse of the addiction and it costs the Americans about $484 billion a year. This figure also includes the health care cost coverage, job loss wages, traffic stops and accidents, crime and associated criminal justice cost systems. According to the National Highway Traffic Safety Administration, about 10 to 22% of car crashes that were involved an individual that was using drugs. Another major factor into drug addiction is stress. Stress is a major leader in following an addiction. Sadly, nearly 2/3 of people that were in treatments or rehabilitation centers reported that they were physically or emotionally or sexually abused as children, as to why they became addicted to drugs. Now, over 6 million children in America live with at least one parent that is addicted to drugs. The most commonly drug other than alcohol in the United States by individuals over the age of 12 were used follow as marijuana, following prescription painkillers, cocaine, and hallucinogens. According to the NIDA, researchers have found that both women and men are equally likely to become addicted to or dependent to one of the others, cocaine, heroin, hallucinogens, tobacco, inhalants. Women are most likely to become more addicted or dependent on sedatives and drugs designed to relax people for anxiety, sleeplessness, and less likely than men to abuse alcohol and marijuana. We wonder why people take drugs. Well, there's a lot of answers out there, but in general, people start taking drugs because they want to feel good. They like that pleasureness feeling. They want to feel high. They feel that when they are in this stage, they feel that they have a sense of feeling better about themselves. Also, they feel better that they can do something, that they're better at this when they're high. They can do this. And another reason, is just curiosity, out of wanting to know what it's like to do drugs. And some people do become addictive just being curious, just because they want to hang out in that crowd that's doing it. So we ask ourselves, is there a treatment for drug addiction? Yes, there is. There's lots of treatments out there for everyone. Addiction is a treatable disease. Discoveries in the science of addiction have led to advances in the science addiction have led to in the treatments that have helped people stop abusing drugs, and they resume their lives again once they can go through that treatment program. Like other chronic diseases, addiction can be managed successfully. According to the www.drugfree.org intervention website, one treatment method is not necessarily appropriate for everyone. The best programs develop an individual treatment based on their plan is really just an assessment of the individual to see where they're at and where they need help at. Researchers indicate that a minimum of 90 days of treatment for residential and outpatient drug-free programs and 21 days for short-term inpatient programs have an effect. To maintain the treatment, there needs to be lots of follow-up, supervision, support from the family. That's one big thing that they're going to need, is help from you to help them go through this treatment program. In all recovery programs, the best predictor to success is the length of the treatment. It is shown that when a patient has been in a treatment at least 1 year, they are more likely to be drug-free in the future. Prevention. Is there prevention for drug addiction? Researchers do show that from the NIDA, funded research have shown that prevention programs that involve families, schools, communities, and the media are effective in reducing the drug abuse. Although many events and cultural factors affecting drug abuse trends, when youth perceive drug abuse as harmful, they are less likely to take the drug. It is necessary, therefore, to help our youth and the general public to understand the risk of drug abuse, and for our teachers, parents, healthcare providers, professionals, we need to just keep sending the message out as their youths so that the prevention can take place, and so we will no longer have to see drug addiction in our society. So the main key is drug addiction can be prevented if a person never uses drugs. Thank you.